Give me a second here. I'm going to resituate the Zoom. There we go. Okay, so I'm going to call this meeting to order. It is October 21st, and this is the Behavioral Health Committee of the Incarceration Prevention and Reduction Task Force. And before we begin, we want to acknowledge that we're gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us here together today. And please join us in uncovering such truths at any and all public events. And so I'm calling us to order officially. It's 9:01, and I wanted to welcome everyone here today. Thanks for coming. I know that you all are busy folks. We've got a number of items today. They're all important, and I just wanted to say thanks for being here again. Our our first item is the 2026 action plan for committees and work group structure and calendar. And that will be on packet pages 1 through 4. And that's a discussion. It says for committee co-chairs, but I really want to open it up to the group and not make it just about Brian and myself. But if you'll scroll down a little bit, it's the tables that are there. It says topped with focus topics and action items. I'll kick it off a little bit, and then I would like to open it up for discussion. Please feel free to, if you've got a question, to just chime in, basically. So the first item was member recruitment, and that was pursuant to Goal 6 of the task force's co-chairs report. We were trying to bring in um, multiple people to create a culture of productive engagement and impact and action with the task force and our county partners by encouraging and supporting greater representation of frontline staff and people with lived experience on the committee. This is manifest in a variety of ways, including on the J-pop with folks that have been incarcerated. And we had a panel um, not too long ago with the task force. And so I think that's been it's starting to get accomplished. And then as far as broader recruitment, I feel like this committee has done its work in that, and we brought in a number of people to add to the committee. And I want to turn it over to Brian to talk about diversion reentry and just kind of progress as relates to that particular topic. You get muted, buddy.
Yeah, the work group met a number of times, and we struggled a little bit in terms of the current environment related to, policies of, prosecutor and some of the courts. And some of the members suggested that, unless we really have some best practices or things that are not so funding dependent, that it really was difficult to make, suggest things that involve significant progress in resolving some of these long-standing issues. That said, I have met with Wendy, the former head of the jail, about the King County audit report on jail health, and she is talking to Caleb, and we may have some things that come from that discussion. But at this point in time, I think some of the activities of this group are a little bit on hiatus because of some of the tasking that I believe is coming down from the steering committee about work groups, and perhaps reforming this and having this be a broader work group beyond just members of behavioral health and law and justice. So that's a little bit about kind of where we where we are related to some of the bullet points there under the things we were looking at. And, it's always been with reentry, there's a number of steps it could take, but until, as Perry, what was Perry's last name, Dan? Former, who worked with Melora.
Maori.
But yeah, Perry Mowrey used to say, unless we have true wraparound services, we really can't do some of this reentry stuff, at least do it very well at all.
Sure.
So that's just a continued constraint. So I'll leave it at that. If there's any questions, please let me know.
Okay. Any questions for Brian and network group? Okay. Just kind of scanning here. I don't see any. Okay, let's move along here. The next item was Division Street Behavioral Health Campus. There are a number of people in that work group that are on this call today, and so I want to share that subcommittee was meeting every 2 weeks to try to come up with recommendations as relates to creating a behavioral health campus at 2030 Division. And I see a number of experts here, Tori, Arlene, Hannah, that have been on those calls, and just want to commend the entire group for the work that was done. And um, I don't know, Hannah, Tori, Arlene, do you have any thoughts you want to share on that? Feel free. Arlene, you're muted.
Yeah, I'm sorry. That the ideas for fundraising were very good as a start. I think a great deal more will have to be accomplished, but they've made some very good suggestions for a beginning, and I think everybody in the whole group has to go after funding. If you know anyone or people who are skilled at raising funds, we do have them available, and they are very important to our work.
Okay. Hannah, Tori, you have anything to add
Yeah,
to
I'll
that?
just jump in here and say one of the frustrating things is finding ways to make operations funding sustainable. Um, you know, particularly if folks are coming in that may or may not have any type of insurance. And so how to go about doing that is probably the most challenging thing. But I think we said, well, funding, the capital dollars are there to kind of get it stood up, but it is the operational stuff that's going to be a challenge. And so maybe that will materialize at some point after the jail gets built and more time passes.
Okay. Thanks, Tori. Hannah, do you want to add anything?
I mean, I think I spoke on this at our last meeting. I think that the conversation was really robust, and I think that the group really acknowledged that there were so many competing needs in our community, and trying to narrow down the ones that maybe made the most sense to put together for the consumer, for the person who needs the services. And then what Tori was saying is, and also figuring out what could be on the campus that could help make it more sustainable. So we went really big because it felt like every time you added something, there was another piece missing in order to make that happen. And then we had to kind of try to scale it back down to what felt maybe more of a targeted intent for our work group. And I think that all of that stuff still lives there though, right? That we still have so much work to do. And yeah, I'm so glad Tori's here to talk about that, because she really brought some expertise to the team that we just didn't have. So yeah, it's a lot. And I'm glad that we're talking about different ways of bringing services to our community though.
Thanks, Hannah. Anyone else want to chime in on this item for division? Any thoughts? I'm just going to quickly scan, and I don't see any hands. Okay. I'll do a summary real quick and in just a minute here after data goes. So I want to transition into item 3, which is data work group recommendations to the task force. I think that's probably a good segue at this point. And then I can just do like a quick recap on just my take on division, and then I want Brian to provide just a quick recap on reentry as well. So data work group, Bertie and Dean, you're up.
Go ahead, Dean.
All right. Well, Bertie and I talked briefly later last week, maybe it was early this week, who knows, about sort of where we see things at this point with the data work group and its ability to move forward. As you know, we endorsed the recommendations of the Village Reach report, which this committee then also did, and moved on to the task force, and it was endorsed there. We also, as a data work group, emphasized the importance of one of the recommendations near term, which was to bring some person on board who can basically manage the implementation of all the recommendations in the Village Reach report. I guess I would say that our sense right now is that without substantial investment in both that recommendation and the development of infrastructure for data in the county and the various parties in the legal and justice process, there's not a lot more for the data work group to do. We can continue to advocate for the development of those resources. But one of the main recommendations in the later term, in the next 12 to 24 months from that report, is the development of a robust data infrastructure within the county and all of its parties. And I would just want to add also, data serves two purposes. One of them is it's sort of the circulatory system for the whole process by which people move through and divert from the criminal legal system and into alternative services. Data helps people communicate with each other about the status of individuals and what their eligibility and potential might be. It also then provides a source in the aggregate for evaluating whether we are in fact achieving some of the goals that the county has as articulated both by the IPRTF and the Justice Project. So we're at a kind of a standstill point, waiting for guidance about how can the county proceed with devoting resources to implement the recommendations that make data available. Bertie, did you want to add to that?
I agree, and Cedric is here as well, also from the work group. I think that's where Dean and I landed, and if you have anything to add, Cedric, I think that would be really helpful. We can continue our advocacy, but the sad part is that I think our IPRTF endorsement and recommendations has kind of been lobbed into midair and nobody's caught the ball. So there's kind of no owner of this at this point. And until it lands with a owner to organize things, we felt that on our charter, we specifically excluded things as being out of our scope. And one of them was developing budgets and things like that. And at the last IPRTF meeting, Kayla of the exec office somewhat asked for that. When Peter asked what could be done to be helpful, she said, we need a 3-year plan with a budget and individual steps to get to the data. And so I would bring up to this group, where is the responsibility for doing that? IPRTF in general is supposed to make policy recommendations. So I think the lack of an owner for this anywhere in the county is a significant barrier.
Thanks, Bertie. Cedric, do you have any thoughts or?
I think that's an excellent summary. I don't have much to add.
Okay. Okay. Any questions for the data work group? Brian, go ahead.
I have one quick question.
Oh, Tori, go ahead.
Just to kind of follow what Verdi was saying, given the upcoming budget cuts, how much is this going to impact any of this?
Sure.
And that's all I have. That's my own.
Uh, good question. Brian, go ahead.
You're muted, Brian.
Brian, you're still muted.
The executive should own this in terms of, it's not our role to develop, a funding plan or something like this. But do we have any sponsors on the council that could draw attention to this? And given budget constraints, this might be a slow rollout, but it seems like between the legislative and somebody in the executive, somebody should take ownership of this and not just pretend that this need is not important and actionable. So how do we create or persuade someone in the executive or on the council to keep this, on their radar?
That's a valid question. I'd like to remind folks on the call here that there's an election in exactly 2 weeks, and there will be some churn on council. There'll be some new members. So I think that question could be revisited after the dust settles, so to speak.
Mhm,
So yeah, I mean that's valid for sure.
mhm,
And I don't want to put county workers on the spot here and trying to answer those questions. I think that's not fair.
mhm.
But I do, yeah, we've got some work to do, but I think it's gonna be post November 4th, essentially. Jill Nixon, go ahead.
Hi, everyone. Yeah, just as a council staff person, hopefully reassure you a little bit that the task force made its recommendation at the September meeting, and it was forwarded to council on October 2nd. That really was only just a couple of weeks ago, 2, 3 weeks ago. Council moves slower than that, and the IPRTF representative on council is Barry Buchanan. And Dan, you're absolutely right. A lot of folks are involved in election season right now. And things might settle down once, as you say, once that dust settles. So I would say council, I can't speak for the exec's office, but for council, they just received the task force recommendations. So a little patience. I know it's frustrating, but a little patience might be in order. That said, you're all welcome to lobby the council members, get in touch with them, and express your support individually for that recommendation as well.
Thanks, Jill. It's a good reminder. So councils do not move fast. I can attest to that. And I see LT Nelson on the call today. He was there last night during a long council meeting. That's just the nature of just how councils work. So, but I do agree with Jill that it is worth chiming in, providing your opinion on items that are near and dear to your heart. Okay, so anything else with data at this point? Brian, go ahead, and then Arlene. Sorry.
I was just wondering if we could revisit this at a January or February meeting. The dust will have settled. We'll have the new county council members seated. We could possibly invite Barry to the meeting or somehow, but not to lose sight of this. But why don't we think about? I think January or February would be a good time to revisit this.
Sure. No, I agree. I think that a reboot for next year is in order. Yes, to that question. Arlene, go ahead. And you're muted, by the way.
Who do we need to go to provide leadership on this issue?
If you're asking, I would say that leadership on the task force would be helpful. So our co-chairs, Peter and Heather would be good. There's a steering committee that meets once a month, and just going to them would be helpful. And then beyond that would be the executive's office and the county council.
Does the sheriff or the police chief have anything to do with this?
Probably not the police chief. This is a county.
Oh, that's right, yeah.
Yeah, I'd say, I think that Sheriff Tank would be perhaps open to ideas. So I think that would not that'd also be a good contact.
Okay, thank
Alright.
you.
Thanks, Arlene. Okay, I'm gonna keep us moving along here. We're doing really well on time. It's 9:21. Let's see. I'm gonna hold on. Let me toggle real quick here to 1 second. There we go. So I want to move us along here to diversion and reentry. And so that is item, 1 second. That's item 4. It's reentry work group and Division Street work group. Brian, do you want to talk a little bit about reentry and how that's the work group and how that's going?
Well, I think I would just reiterate what I said earlier, that we're just sort of on, hiatus. Because of the factors I talked about before, lack of funding, some number of policies, by separately electeds that get in the way of making, true progress on that. So we really haven't, in terms of reentry specifically, we haven't really done too much. So and given that the steering committee is, as I understand it, going to be kind of repurposing the way some of these work groups are formed, that I think it makes sense to me to wait and see what their guidance and direction is. And I think from what the last steering committee, correct me if I'm wrong again, I think that they're talking about maybe different members of the community that aren't involved with any of these committees, potentially being members of these work groups. I don't know. I mean, they didn't really flesh that out, but I think they're going to probably look a little bit different than just the work groups that we formed here with Law and Justice in our committee.
Okay. Anything anyone else wants to add to that? Okay. I'll try to summarize the Division Street work group real quick. So basically, like I said, we're meeting every 2 weeks, and we're making pretty steady progress. And then a recommendation came back that the behavioral care center be located at 2030 Division Street versus La Bounty. So that really put the brakes on for us a little bit. And so we need a little bit more clarity from task force recommendations. And I don't know if Melora or Hannah, if you have any thoughts on that, or or Arlene or anyone from the work group, or Tori. Melora, do you have any thoughts?
And I'm sorry, what exactly are you wanting me to weigh in on?
Oh, just there was we were going in one direction when it came to doing the 23-hour crisis center, and there were some questions on operational dollars
Mm.
with that, and like how do we move forward? There was kind of like the longer term aspirational goal of repurposing the work center into perhaps like a full medical center, and a lot of talk around that. And then the J-pop and well, I think it was J-pop that came back and said, look, we want to consider having the behavioral care center that was originally slated to be on La Bounty to potentially be at Division. And so there was just kind of like this churn of ideas. And so I don't know if you have anything to add, and if you don't, that's fine. But that's kind of where we stopped our work.
Yeah, no, I mean, I think all that I would add is, and you've kind of set this up well in this meeting, is that there's a lot of decisions that will be made in the Justice Project Implementation Plan, that once those decisions happen, then kind of the next steps of planning what is possible can come from that. And one of the big pieces is that decision of, is the behavioral care center in custody or out of custody? And if it's out of custody, then is it located at the Division campus, or is it located next to the new jail, but as a separate entity? And so, their recommendations have been made already from different groups. And I don't know if the Behavioral Health Subcommittee, if this is a space where a recommendation could be made based on the different presentations that Hannah Fisk has been giving kind of throughout the Justice Project plan. So, I do think that what we're seeing in the data and understanding the funding challenges is that there are additional opportunities if it is out of custody. And that allows, because it is meant to be a prosecutorial diversion program, with it being out of custody, there are opportunities for diversion from a prosecutor or from the courts. And in addition, the whole community could utilize it as well. And we could be billing for Medicaid and other non-Medicaid reimbursement. So we would not be able to do that if it was an in-custody prosecutorial diversion program. And I'm not sure, Hannah, have you given your presentation to this group, or was it to the full task force?
I don't think it was to this group specifically,
Yeah.
It's kind of blur together a little bit.
I know there's been so many presentations. But just kind of going back to that's the big decision that needs to be made. And then once that decision is made, then thinking about what can be prioritized at the Division campus, we can kind of start moving forward with that. And I love that there is a work group envisioning these pieces, because it's really getting ahead of the planning process. So yeah, that's what I would add. And I don't know if Hannah has anything to add to that.
No, I mean, I think that was a really great summary, Melora. I think the only thing that I would add is I don't know if the things are mutually exclusive. So if it continues on, if the BCC continues on as it's intended, which, I think we're waiting for the behavioral health analysis to really confirm that this is what is the best prosecutorial diversion. But let's say it was to continue on as needed, which is an inpatient treatment program that serves both SUD and mental health disorders. I don't know if that negates any of the planning, Dan, that was done by that group, because I think that was also included in some of the ideas and concepts. So I think it would just kind of further confirm that the work group and this is on board with the same mission, except the work group wants to continue to make that a more robust community at Division, right? So I think that group just continues on in the goals. So if that sub work group, though, does not want an inpatient facility on that site, then I think that could be the potential problem, or where they would go different directions, and where if the BCC was located on Division, that would impact the work group's visioning. So I think that would be the crux of it. That would just need to be sorted out. And if there is a clear disagreement, I think that should be made clear so that this subgroup can weigh in and make sure that that's known to our community. Does that make sense?
Yeah, thanks, Hannah. That's a good. And Melora, thanks. Those are great summaries of where we're at right now. Dr. Wu, I see your hand.
Oh, I just wanted to comment that Hannah gave a great presentation to the rec a couple weeks ago, and really appreciate that. And if any of the committee members haven't had a chance to hear Hannah's presentation, I would I wouldn't ask you to do another one, but I would say when the opportunity arises and a presentation is happening at at a place you can catch it, I would definitely recommend catching that presentation.
Thanks, Dr. Boo. Melora, go ahead.
I would just also add, and maybe we could send this out to the subcommittee, but Hannah did do the presentation to County Council. And so that's a recorded presentation that could be sent out.
Okay. I think that might be useful. Jill, if you can track that down and maybe we can get that out to the committee here, that'd be good.
Yeah, both the county council presentation and the full task force presentation are available, the videos. So I will get those links and send them out.
Okay, thank you. I think I just was reflecting here when Hannah and Melora were talking. I think the animating um, decision is the in custody versus out of custody. That makes all the difference. If it's in custody, then it's probably going to be LeBounty. Probably, maybe not, but probably. And if it's out of custody, then it could be division. And what I hear from law enforcement leadership is in custody preference. And I get a different perspective when I talk to people that are in different sectors. So I think that subcommittee, that work group needs to really kind of drill into that question of what kind of facility are we talking about. And there are different, I mean, Melora said it best, like, Medicaid, how's that going to work for in custody? And given the shenanigans at the federal level right now, everything seems a little uncertain. And I'm going to stop editorializing there because I see some hands up. But Dean, go ahead. I saw yours first, then Tori.
Yeah, so I'm a panelist today really because of my role in the data work group. So if this is a comments that to be reserved for public comment, I'm happy to do that. But so stop me if you think I'm going.
Yeah, go ahead. Go ahead.
But Dan, the other day when you heard the presentation about in versus out of custody, and you raised the question about is it necessarily a binary decision? Could there be both in and out of custody, I think was your point. And I guess I'm just wondering whether there's also been given consideration to splitting the jail beds and having a much smaller facility out on the Bounty in order to provide some in custody space that's certainly much more therapeutic at Division Street in order to create the opportunity for closer interaction between custody situations and people needing to have the benefit of being served out of custody. So I just would, raise the question about whether there's been consideration given to that idea as well. And, if I'm being naive, forgive me.
No, okay. I'll answer your question in a minute, but I want to get to thank you, Dean, for that, by the way. Go ahead, Tori.
Dean, we're thinking alike. This is probably ignorance on my part, please forgive me. So my understanding was that we're looking at a diversion program, and there are times when in custody may be necessary, but along the same lines as what Dean was discussing, and also including Medicaid eligibility for people. The use of ankle bracelet monitoring can be used in other settings, and can those folks, I believe it's true, but I think that we can use insurance with them if they are more closely monitored for people who need that. But I don't know the law, and so you may have to school me on that. But my real wondering is that if we are attempting to try to do an in custody behavioral health program, which may be based upon length of stay due to their sentence, then you're looking at length of stay based care as opposed to medical necessity care. And how do you marry that in an in custody program when the rest of the world is operating off of medical necessity. Hopefully that makes sense.
Thanks, Tori. Dr. Wu, you had your hand up.
Yeah, two thoughts. One is I had the same question that Dean had about either or both in and out of custody at Hannah's presentation to the rec. And Hannah gave an answer which I think was a very practical one. And correct me if I'm wrong, Hannah, but my understanding of it was that if you looked at who was eligible for what, almost everyone who was eligible was actually eligible for out of custody. So there wasn't actually much of a need for both if you had out of custody behavioral health treatment. Correct me if I'm wrong about that, Hannah, but that was my understanding. And the other thing I wanted to say is that, reading from from personal experience with people I've worked with, and also from reading the comparison between what Los Angeles County does in custody versus what Homeboy Industries does out of custody, it really echoes what a person said to me once, which is that it's really hard to heal in the same place where you've been harmed. And I think a lot of the folks who need to heal from their justice experiences may well be too vulnerable to actually do that work when they're still in a justice control system. They may really need to be out of custody in order to actually get better.
Thanks, Dr. Wu. Lieutenant Nelson, see your hand up.
Yeah, I was just gonna speak towards the ankle monitoring, Tori. I don't know if this is the appropriate platform or if we should have a conversation on a sidebar. Dan, I don't want to take up too much time.
You've got plenty. We're doing really good on time. So if you want to have that discussion, go ahead.
Yeah, I just wanted to point out that if that was something, I don't know the legality of doing that for someone who's got a behavioral health. Now, if it was tied to a criminal act, then that obviously is friendship diversion is our platform for that. But you would have to look at different funding sources probably with who is actually going to pay for that monitoring. Currently, that falls into the police department's budget. So I don't know that we could sustain an increase in that to also capture the behavioral health side of the house. So again, I think these ideas often are good, but we have to consider who's going to eventually pay for them, obviously. So if there's any other questions about home monitoring, I'm happy to answer them.
Okay. Committee, any other questions pursuant to that? Okay. Okay. Okay, I just thank you. Thanks, LT. I just want to circle back to Dean White's observation about the either or versus both. Like, could we do in custody and out of custody? I don't know. I mean, it's going to cost money, and money's kind of a little short right now. On the county side, I think that's 19 million in the hole, and then we're at 10, soon to be 6 because of the 1/10 of 1% that the council passed. So I just don't know what the right answer is, but Dean, go ahead. You wanted to follow up?
I wasn't really talking about pursuing the both and related to the behavioral care center. I was raising the question of whether we ought to have 2 locations for jail beds.
Sure.
That's all.
Okay, no, I totally hear you, and that's a valid point, and that's definitely come up in discussions in the community. Hannah, go ahead.
Yeah, I think that has been discussed. I think you're talking about increasing correctional staffing dollars and in a place where there's constant need. So there's currently open positions in that department, and so that can't be filled. So I think that's kind of a twofold, right? Funding and can you staff 2 facilities? The other part is, yeah, I mean, like Dr. Wu said, like you nailed it, that when we looked at who would be eligible for these, those people who would be eligible for in custody would also be eligible for out of custody. And we're talking about pre-trial. So these are people who are really early on in their charges, and we could possibly actually have them not be charged or have their charges dismissed. So this would be much an earlier intervention and for people who don't pose a risk to the community. And so what we found is when we looked at eligibility and what the research shows about long-term institutionalization of humans is that if you can get them out of custody longitudinally, we're looking at a higher success rate because there's more reintegration back into the community. So it was kind of like it hard to argue, right, that with the data and with the people that could be served, that you would want to keep them in custody if it's the same population. Because at first I think we thought that there'd be more of a discrepancy, that there'd be some that would be eligible for out, and then there'd be people that the prosecutor would never consider if it was out of custody. And what we found out is that that just wasn't true. But in that process, we did ask, like, if we go out of custody, who's left in the jail, right? And so we did find that there is a large population still in the jail, right? Our national stats match with local, right? We're talking about 70+% of people in the jail have some sort of behavioral health related disorder. And so there's still a percentage of people in the jail, and that's why our advocacy efforts kind of, it does rise some sort of hybrid option that says, get the people out of custody who are eligible, who are safe to do that, let them get treatment, let them have diversion options. And for the people who that would never be possible for, how do we give them treatment or give, let them have the option for treatment while in custody? That could possibly be used in court hearings as a diversion if the courts allow. So maybe the prosecutor's office isn't comfortable with that right now, and who knows, that's an elected position as well. But it came down to, how do we also advocate that those services happen in the jail for people who are in custody? And that's where the hybrid kind of came out of. That allows people in custody to receive treatment and out of custody for different populations. And so it's a really fascinating kind of thing based on just data and our local officials and what they say are eligible categories.
Thanks, Hannah. I see some hands up. Lieutenant Nelson.
I think Hannah brought up a good point. One thing I think we do need to remember, though, in this community, we're dealing with 3 different court systems, and so it's not just the elected. That would be Superior Court, where you're dealing, and district. The Superior dealing with felonies. In my experience, I would say that the mental health, when we look at the behavioral health population, it's often more of those lower level crimes. So for us, it's actually going into municipal court, not Superior Court, which is obviously a different avenue. And then in these discussions, I always like to bring up, and I feel like I'm sort of hit this every time, but I do want to also remember the victims that occur in these crimes, and also kind of acknowledge that they should have a voice in these discussions as well, beyond just folks who are suffering with behavioral health issues.
Well said. Melora, go ahead.
Yeah, I just wanted to add to what Hannah was sharing, and you would see this in her presentations as well. But if we go with an in-custody prosecutorial diversion program, and we end up having an elected prosecutor that does not believe in diversion, there's a risk that that facility would sit empty. So there's another piece to that, which if it's in custody and we don't have a prosecutor's office or offices across the county who want to utilize it, there's a risk in that because it is an elected position. The other thing, just to be really clear, is that if we do an in-custody behavioral care center, Medicaid cannot be used for that. And non-Medicaid insurances would not be able to be used for that. So that's just 2 really big clarifying pieces that have been part of all of the considerations.
Thanks, Melora. Tori, go ahead.
Not that long ago, we had some discussions about the Involuntary Treatment Act and how some of that needs to be modified, and how we need to find somebody who can introduce a bill to modify that. And in doing so, could some of these, especially the lower level muni court stuff, be included in that? Because right now the ITA is more like has a definition of danger to self or others, and maybe a new bill needs to be introduced in order to embrace this idea. So just a little legislative work.
Sure. Okay. Um, well, that's a good discussion, folks. Well done. Melora, go ahead.
Just really quick, I haven't heard an update, but I know Chucknut Health Foundation and Eric Ritchie and other prosecutors across the state were doing a listening tour on the ITA law with, I believe, the intention to put forward a report or a recommendation. And Dr. Rue, I don't know if you're involved in that, but it would be really helpful to know where that process is. Because again, I believe the listening tour across the state was meant to gather information for potential legislative advocacy.
Dr. Wu, do you want to respond to that?
Yeah, I'm not directly involved in that. I hear about it when I'm in the office. I know that the tour has, I think, been done. I think the report is in process, but I can get the committee an update on that.
Thank you.
That'd be great. If you want to bring that around next time, that'd be excellent. Hannah, go ahead.
Yeah, we reached out to her, Dan, in one of our meetings, to Heather Flaherty and asked for an update. And I think, was that in September? I think, and she said it's almost done, was her response. So yeah, it's coming.
Yeah, more to come on that one. We did reach out, and thanks, Hannah, for pointing that out. So hopefully at the next meeting we'll have an update on ITA. Okay, I don't see any other hands raised. Okay, shall we move on? We're about 9:46 right now, and we're gonna get you out of here early today, I think. So give you hopefully half an hour of your day back. Anything else pursuant to reentry or Division Street or any of the items that have been brought up here thus far? Okay, seeing none, I'm going to move us along here. Item number 5 is the Deep Wellness Center. I just have a brief update. The second mobile medical unit will be deployed, I think, on November 3rd, which is a Monday, at Unity and I'm going to blow this. It's it's right across from the Chinese restaurant and next to the Baptist church. There's a small parking lot there, and it'll be deployed there. So it'll be very centrally located in the downtown area. And I am actually going out with Leon John in a couple of hours to do some outreach to folks and let them know. The Swinomish tribe will be contacting um, this is hard for me to believe, but this is what I've been told. Every mailbox in Whatcom County will receive a notification that this resource will be available for folks. So that's good news, I guess. And I want to just point out that Lemmy Nation has also stood up a wellness center as well. And so there's very comprehensive treatment options that are available from our tribal partners. And just want to acknowledge and pay respect to those tribes that are really doing really great work out there for folks in the community. So any comments on that, Melora? Go ahead.
Yeah, thanks, Dan. That is an amazing update about the mailers. Yeah, also just an update. I'm sure many know that Lummi has opened their low barrier tiny home village and specifically have been prioritizing people who live in the Walmart encampment. And so people have already been moving into those tiny homes. And so it's just another really big update.
Yeah. Thanks, Melora, for that. That's great. I went to the ribbon cutting for that back I don't know, a couple months ago, and it's pretty incredible the resources that Lummi is bringing forward. And just speaking of tiny home villages, we did open up one on Northwest, um, kind of by there's an old credit union building that we actually bought, and we have our life safety fire folks in there. The tiny home village is adjacent to that. I think it's 50-ish homes, and talk to some of the residents there during that ribbon cutting, and everyone seems really excited about that sense of community that's within um, uh, that area. So just really good news. Okay, anything else pursuant to any of those items? Okay, seeing none, other business, for the committee. Any future agenda items, anything that's, burning in your neck of the woods? Laura, go ahead.
Yeah, I have a suggestion for a future agenda item.
Okay.
So the Response Systems Division, which operates Grace, Lead, Mental Health Court, the Alternative Response Team, and a small street medicine team, we are in the process of writing a solicitation for a diversion evaluation of our programs. And we have already worked with some evaluators in the past for the alternative response team and the co-responder program when it was with the sheriff's office. But what in both of those evaluations, what we realized is that the evaluators wanted, in order to know the impact of the program, they needed to evaluate the whole diversion system in order to really give a report of if that's working as diversion or not. And so our hope is to put out a solicitation for a multi-year evaluation of these diversion programs that looks at the impact to the larger system. And can we answer the program? Is it truly diverting people from legal charges or legal involvement? Is it diverting people to treatment? How effective is that? What are these interventions effective? And we have secured some funding for that. But what we are hoping for is some feedback from our community partners on what we need to make sure is in that evaluation. And we'd love to get that information before we bring an evaluator on. And so we're looking at hopefully getting someone on in the first quarter of 2026. So if there was time in one of these meetings to talk about what this group would like to see in an evaluation of the diversion programs that are operated by Health and Community Services and their impact to the larger system, that would be very great for us to get that feedback.
Okay. Committee, any objections to putting that on as an agenda item for the next meeting? Okay, I don't see any. Laura, would that work for timing if we did that at the November meeting?
Yeah, that would be great.
Okay. All right. I think thank you. And thanks for that ask. Very important. Brian, go ahead.
Were we going to talk about the structure for and frequency of our meetings for next year, or has that already been decided?
I don't think it's been decided. I think it's flexible. I think it's what the group wants to do.
Oh, okay.
We had talked about reducing the number of meetings per calendar year, but I think it's anyway, I'll leave it up to the group. It's your call on what y'all want to do. We could go to every other month. I think that was definitely discussed. Or we could maintain the like 10 meetings per year with taking a couple months off, like maybe one in the summer and one during the holidays or what have you. So anyway, Brian, let me get back to you on that one. Is that okay?
Yeah, and I also think it depends on the structure of these work groups. If the work groups are still meeting where, a lot of the work of the committee happens through the work groups, there may not
Sure.
be as much of a need to bring the whole committee together as frequently.
Sure. Okay. Let's talk about that offline, and we'll get back to the committee in November and come back with a recommendation. Dr. Wu, see your hand.
I was just struck by the contrast between some of what we talked about and the barriers that we were experiencing earlier, and then the reports from Dishwalik and the Lummi Nation. And I just wonder if philosophically and practically there is something we could learn from that contrast and from our Indigenous partners.
What can you elaborate a little bit on that?
Well, Brian was talking about how there's a shortage of funds and resources and barriers in the way of some of the diversion projects, and the subject of short funding came up multiple times, and yet the Dijwalik is sending a mailer to every mailbox in the county. It's kind of a mindset of abundance difference, I think. And I just wonder if it's a question of prioritization and who is central in our thinking that is making the difference.
That's that's a great point. I couldn't agree more. I think that with the tribes, I see them centering the person, the patient, um, and recognizing the tremendous need that we have in the community. And I think it is a different mindset. And you know, tribes are sovereign nations. They have control over their destinies when it comes to those items. And I think that I don't want to go too much on a soapbox here, but I think that cities and counties have a different perspective, and it perhaps is not the best. I do think that I do want to acknowledge that we, in particular, Melora's group and Hannah's work, and our police department, I'm speaking for Bellingham at this point, are doing tremendous work when it comes to um, providing for public safety and for treatment modalities that are unique and response systems that are out there doing the hard work every day. And so I do want to acknowledge that. That's really important stuff. But I do think the tribes have and I'm just speaking for Swinomish and Lummi to some extent, and I don't want to speak on their behalf, but what I've observed is, you know, what Melora brought up about the tiny home village out at Lummi. Like they really took that super seriously and made investments, and it's wonderful. I mean, if you get a chance to take a tour or what have you, they do really excellent work. And then the Swinomish, the gifting of the mobile medical units, um, it's it's tremendous, and you know, lives will be saved, and lives will be turned around. So I want to leave it at that. I don't want to sit here and take up all your time, but I do think that there's excellent work out there that's being done, and it's you're right. It's how do we center the patient, and then to Lieutenant Nelson's point about acknowledging that there are people that are victimized by crime too. So we need to balance both. Dr. Rude, do you want to follow up with that, or?
Yeah, well, my comment was not to criticize the work that is being done, because I agree there is really excellent work being done, you know, by the PD and the sheriff's office and the diversion programs that we have. I think the work is excellent. I just think that perhaps we are swimming upstream against a culture, institutional culture, that doesn't center the person. And I think when we can change that culture, and you know, that would include centering victims, right? Because they are just as much being harmed as the people who are justice involved. But I think it's a false opposition to put the victims' needs and the perpetrators' needs against each other. They're actually both totally legitimate needs, right? And treating one does not mean ignoring the other. So I just think that it's important for us to remember that part of the reason the work is difficult is because we're swimming against a culture that does not center people. And I don't think it has to be that way. And I think our Indigenous neighbors are showing us that it does not have to be that way. And I think there are really basic cultural, philosophical things we could do that would make this work a lot easier. And I think it involves being really consistent about centering people all the time. And one of the reasons I think we have difficulties and we have difficulty attracting people with lived experience to these forums is because we don't actually center them, even though we say we want to. You know, some of the people on this call are doing their job, right? Which is great. Some of us are here because we have done a job in the mainstream culture that allows us the financial freedom to do this kind of stuff voluntarily. But most of the folks who really have the lived experience are not in either of those positions. And I think if we want them to show up, we need to compensate them appropriately and have them here all the time, so that when we say we can't do it, we're actually looking at them. because I think it's harder to say you can't do it when you're actually looking at the person who knows what that means.
Sure. Mueller, I saw your hand up. You good?
Dr. Wu said it all.
Okay. I'll just comment just real quick here. So the all hands summit that happened a couple of weeks ago out in Ferndale, there was a lived experience panel, which was you hear the stories, and it's pretty breathtaking when it comes to what people have gone through. And um, and I agree 100% that lived experience folks should be part of these conversations. And it's been a perennial um, topic of discussion since I started on the task force uh, 10 years ago, that we need to have those voices in the room, and to center those voices and listen to that. And I do think that people that are impacted as victims need to be there as well. And I do agree, it's not a binary, it's not one or the other, it's all. We all live here, so I do agree. Okay, so any other items for other business today? Brian, go ahead.
I did have a brief slide deck talking about kind of a legislative update, and specifically related to some of the things related to funding, resolving some of the funding concerns for 23-hour facilities.
Okay, do you want to share that? We got a little bit of time here.
Sure. So Jill, can you let me share my screen?
You should be able to share. There's a green button at the bottom.
Okay. So you're not seeing anything yet, right?
Would you like me to screen share for you, Brian?
Sure, that would be great, yeah. I'm using a Mac, which I don't normally use, so I'm not sure how to do this.
Can everyone see the screen right now, the presentation? Yeah, okay. Go ahead, Brian.
Okay, how do I make this full, just each slide though? Where is this?
I'm sorry, what is your question?
Well, what are you seeing? Just each slide, not just one at a time, or
Yeah, the first slide, the title page.
is that the only thing, or are there others there? Okay, there we go. Okay. So, just really quick, this is some material that NAMI put together about the last legislative session and some of the challenges that mental health legislation faced, the $16 billion deficit, looming federal cuts, a new governor unfamiliar with behavioral health issues, some of our legislative champions, Tina Orwell, Mogadunga moved to the state Senate. So there were, and also a number of freshman legislators that were unfamiliar with behavioral health issues. Just real quick, NAMI had a lot of emphasis on a lot of youth behavioral health issues, and they did not go where mainly due to the funding situations. I'm going to go through some of this fairly quickly.
Excuse me, Brian, can you let me know when you want me to move to the next slide?
Oh, I'm sorry.
Thank you.
I'm sorry. Oh, you're going to, okay, yeah. So let's just go down to 1432, HB 1432.
There you go.
So this is one of the bills that NAMI highlighted, and it related to greater access to mental health and substance use disorder services related to parity. And they wanted to limit this retroactive payment recoupments, or what they call clawbacks, to just 6 months. And it prevents insurers from shifting costs to public programs like Medicaid. Next slide.
Go ahead.
So related to ITA, that there was is it 1859 that created a task force to look at various to look at some of the legislative framework for the ITA bill or act. And so I think this is related to some of the prosecutorial listening sessions that went on around the state. And I know for some reason they didn't want to take this issue up in the last session, but hopefully they will in 2026. So next slide.
Go ahead.
So I just want to recognize real quick, NAMI does acknowledge legislators that are behavioral health champions, and Joe Timmons was selected as one of those individuals this year due to his work on youth mental health. Next slide.
Go ahead.
So just briefly, some of the kind of higher level 2025 legislative actions related to behavioral health crisis services. This relates to future, rate setting and procurement for services related to accessibility, community outcomes, and gives HCA more authority to realign some of these contracts. So next slide.
Go ahead.
And Melora, I'm sure, and others are familiar with this, but I think one of the key things is the UW is going to create a crisis responder training academy by 2026 and promotes greater non-law enforcement intervention through greater coordination of 988, among other things. So next slide.
Go ahead.
So I think we're moving kind of towards more of the Arizona model of regional operations of 988 and integrating it better with 911 and regional crisis lines. So for example, they plan to launch a statewide crisis data platform, which could be linked to real-time bed and stabilization capacity tracking. I mean, I think that's aspirational, but it's a good goal to have a robust data set about where you might be able to take people. And the other part of this is expanding mobile crisis teams for youth and adults, and then one of those includes Whatcom County. So next slide.
Go ahead.
So we'll get into this more in just a little bit more detail, but they acknowledge in 2026 that HCA is tasked to develop reimbursement policy for 23-hour facilities, also expanding the Native and Strong Lifeline, as well as bilingual crisis services statewide, and integrate more peer and rural response models under their HCA's behavioral health services structure. So next slide.
Go ahead.
Just real quick, this is something I put together related to a number of things that will hopefully be happening next year related to 23-hour crisis relief centers. So as you know, there's a lot of reimbursement and what would characterize as ambiguity for people who are not eligible for Medicaid and lack private insurance. So this is one of the big gaps, and one of the reasons in just a moment it is a problematic for the Everson Youth 23-hour facility. So it doesn't typically fit under what this current definition of inpatient or outpatient definition, how it's traditionally defined. So as a result, middle income individuals without insurance often face high out-of-pocket costs, which shifts costs to local government and hospitals who are forced to deal with these people instead of taking them to a lower cost 23-hour facility. And in Whatcom County, this is particularly a problem for the Everson Youth 23-hour facility that opened, I think, a couple of years ago. And the regulatory rulemaking is still underway related to some of the operational procedures, but also they don't, they fall, into the same issue with, how do we get reimbursement for some of the care that we provide? So, here, I'm gonna go, maybe not go through all this, because it's kind of in the weeds, but these are just some of the things. Oh, next slide, the codified Medicaid reimbursement framework. So these are things I believe based on some analysis of HCA and some of the rulemaking, that they are going to develop a Medicaid reimbursement category for 23-hour crisis facilities. Next slide. And Melora maybe can talk about this, or maybe at a later date, but a pilot program for Whatcom, Yakima, and Pierce to test reimbursement, utilization, and diversion outcomes, and to evaluate this and report back to the legislature by 2026. Next slide. Have a more transparent rate setting methodology. Next slide. So they also want to have more formal linkages between crisis relief centers and the 988 call centers, mobile crisis teams, and 911 dispatch. So next slide. And this is a disconnect as I understand it, but to require the MCOs as well as commercial insurers to recognize CRCs as providing crisis stabilization services. Next slide. And also just to prioritize underserved communities and mandate culturally and linguistically responsive care standards within these reimbursement models. So next slide. This is the last one. So resolving a number of these issues related to 23-hour facilities will, reduce ER visits and jail bookings, provide a more predictable revenue stream for crisis center operators, advance parity and equity, and actually support the continued success of 988. So that's what I just wanted to share with the committee, and I would hope that one of our legislative priorities this year would be resolving a number of these issues related to 23-hour facilities that I just mentioned.
Okay, questions for Brian? Dr. Wu.
Quick question for Brian. I figured maybe you know about this. Have you heard anything about funding for 988 and its current status? I understood that there was some risk there.
Well, I think the cellular tax is still in place. I mean, that's how they fund a lot of this. I really don't know all that's going on at DOH or HCA. And then federally, of course, they cut out the LGBTQ plus line. But other than that, I'm really not familiar. I don't know if Melora or anybody else has more detailed knowledge, but I'm not aware of that.
Okay, maybe Brian, that might be something that you could look into and just
Sure.
get back to us and at the next meeting.
For people that don't know, that the steering committee is developing like a legislative, how would you describe what Peter and I worked on? It's more of a protocol for how we develop behavioral health, policy or capital recommendations at the county level going forward in conjunction with the executive. And they're going to try and do that this year, but we're a little bit late in getting that started. But I feel that really focusing on the need to resolve a lot of these 23-hour funding, facility issues is really important.
Thanks, Brian. Arlene?
Well, it seems to me very important to say that the 23-hour crisis clinic is going to address the problem at the very earliest level of making a crisis, that people can walk in off the street or from their places of residence No obstacle is going to be in their path. That's miraculous to provide that. And it's way before you're involved with the justice system. So it's crucial to that it be providing evaluations and a plan for treatment. It's not offering treatment, I think. Am I right, Daniel? But it is offering what you should do if you want to address your problems, and referrals, of course. So it's not a place necessarily to stay, but to maybe stay for a short time and get an evaluation and a plan.
Thanks,
Thank you.
Charlotte. Brian, you want to respond to that?
No, I said, yeah, I mean, that's one of the big benefits of a 23-hour facility. But I had a question for Melora on the executive side. Have they been working to develop some legislative priorities for behavioral health for the next legislative session that you're aware of?
That's a great question, Brian. And that would be a question for Jed Holmes in the exec's office. I have not heard yet, but from our side, we're working on kind of our legislative hopes. And so we'll be sharing that. And I honestly think that sharing the slide deck with the exec's office would be helpful too, if those are NAMI's recommendations.
Okay, yeah, I did reach out to Jed, but I haven't heard back from him. So
yeah, and feel free to loop me in on that if that's helpful, and then I could, we could have a.
It's just that we need to start these conversations actually kind of over the summer, because if you want to get a legislator's ear, we're running out of time. So anyway, but thank you for sharing that, Melora.
Okay. Any other questions for Brian in his presentation? Okay, seeing none, that takes us to the last item, which is public comment. Jill, do you want to take us through that?
Yeah, we have 2 attendees today. If either of you would like to speak to the committee, you can virtually raise your hand now. No hands are raised, and I don't see anyone in our conference room. Thank you.
Okay, thanks, Jill. Okay, with that, we are at the end of the meeting here, and I just want to again just say thanks to everyone for taking time out of your day to attend. And we are adjourned. Thank you. Have a good rest of your